Thank you, everyone. I understand that lumbar punctures are not the sexiest procedures in IR, but I do want to talk about this positioning device that could facilitate infant lumbar punctures so that you can have more time for your sexier IR procedures. I wasn't paid by the SMöLTAP company. So about 40% of the first attempt infant lumbar punctures at bedside fail. So those cases come to us, interventional radiologists, and conventionally in our institution, we manually hold the infants in lateral decubitus position. So they're kind of just folded up in this shrimp shape, and I have to put a needle in the squirming shrimp under ultrasound or fluoroscopic guidance. Usually awake, of course, if anesthesia is available and safe, we utilize that as well. So one of our nurses who was new to our department saw the conventional way and was a little bit horrified and said there must be a better way. And he took the initiative to look up some alternative methods, and he came up with SMöLTAP. So, we gave it a go. This is a ergonomic cradling device for infants. They look very cute in this cradling device. And these are the images straight from the manual. So you slip the baby into the cradling device, you make sure their arms fit in the guards, and you strap their heads to the back and make sure they're breathing through that hole, which is important. And the IFU states that the infant height requirement should be between 45 to 57 centimeters. So the technique or the protocol that we use in our institution was we would apply the lidocaine cream about 30 minutes prior to procedure, and SMöLTAP device was secured onto our procedure table with straps just to make sure the device doesn't flip over. And then the infant was positioned in the device as described in the last slide and prepped sterilely in the back. And a 22 gauge spinal needle was used to access the thecal sac under ultrasound guidance. So you can see here, we used a hockey stick probe, and this is a diagram showing our needle access while ultrasound guidance is being used, and the ultrasound image is up there as well. So I did a retrospective review of infants who underwent image-guided lumbar punctures prior to SMöLTAP in our institution and also after introduction of SMöLTAP use. And SMöLTAP was not used or could not be used for infants who were intubated or too large for the device, i.e. their height was greater than 57 centimeters. These exclusions were also applied retrospectively to the group prior to SMöLTAP use to allow for valid comparison. And so in the SMöLTAP group, there were 28 patients, no SMöLTAP group, 15 patients. And the demographics data were pretty comparable among the two groups. In terms of procedural data, CSF was able to be obtained in 93% of the SMöLTAP group, 87% in the no SMöLTAP group. Procedural duration, 15 minutes versus 19 minutes. Average CSF volume were similar, and they were all adequate for diagnostic bacterial culture. Bloody tap was seen in 23% in the SMöLTAP group, 15. I'm sorry it got cut off at the bottom, but no complications in any of the groups. Of note, there's no statistically significant difference among these groups because of the small sample size, but at least SMöLTAP didn't perform worse than the conventional way. And I believe there are qualitative benefits to using the SMöLTAP device. There's less demands on your staff to manually hold the baby. So they're less stressed. If they're less stressed, you're less stressed as an operator, and then you don't have to worry about using anesthesia time. So there are some benefits, not quantitatively defined here. And also SMöLTAP, doesn't act just as a holding device, but also it puts the baby in a sitting position rather than a lying position. And there are studies indicating that sitting is superior to lying position for infants during lumbar punctures. A radiology study showed that sitting position increases interspinous process distance and subarachnoid space on spinal ultrasound. And also a pretty large randomized control trial involving hundreds of babies showed that sitting position during lumbar puncture is associated with higher procedural success rates and fewer DSAT rates as well. So in conclusion, based on our early experience, ultrasound guided lumbar punctures with SMöLTAP is feasible and safe. SMöLTAP device, I would say, is for infants on room air, height between 45 and 57 centimeters. And on the manual, there is no weight recommendation, but based on our experience, the maximum weight that we could fit in the device for our babies was 4.6 kilograms. So that's something else to keep in mind if you're using the device. And I believe the company is rolling out with a slightly bigger version as well. And I don't have a say in the matter, but if I could name it, I would call it SMöLTAP with a W. But anyway, thank you so much. Any questions?
Yes, thank you very much. Questions, comments, please.
Thank you for your paper. Obviously, you've demonstrated you can do this with ultrasound, but I'm wondering about sharing this with the frontline people because it seems like it would make it easier and they would have better success and wouldn't trickle down to us.
Yeah, definitely. It's definitely being used in the ER and the frontline physicians as well. And we also decided to utilize it and use ultrasound as well.
The ergonomics of like giving sweeties in that position and then just drip, like, I don't know, we do ours lateral and I think sometimes the speed is great because gravity is helping you, but have you noticed like extended lengths of just in collection times because you're prone or?
Oh, like extended time of collecting the CSF?
Yeah.
They're actually kind of sitting, so I didn't notice any like increased time for the CSF to grip.
Hey, Anne-Marie?
I think as we just started using it, actually was a NICU that brought it to our attention. They started using it. And it really is a tricky device, but they can't be lifting your butt up and swinging down with you know, use a T2 to also hold the weight down. It's a great device. But also for the sitting up piece of it, when kids have any huge trauma, you'll always get through. And you don't have the same issue as lines trying to get proper reaction work. They're in a fixed position, seeing that down with the just a bit years.
Okay, so please go ahead.
Yeah, great presentation. I'm actually just curious because I also do diagnostics radiology, and I think this could be useful for when we're doing, you know, lumbar ultrasound just for diagnostic reasons. I don't know if people in your institution are using it for that.
I don't think our institution uses that, but definitely radiology study has shown that it increases interspinous process distance and etc. So I think that'll be useful as well.
Is this device available in Canada? Would you know?
There's a vendor over there.
How convenient. Thank you. And the price tag? The price of it? We're very conscientious in Canada about it.
We just got it in. We just started representing, so that hasn't been determined.
Yes.
Okay, thank you.
Again?
Thank you.